Welcome, and thank you for joining us today for the meeting of the New York City Health and Hospitals Finance Committee. Today's meeting is officially called to order. I would like to first propose a motion to adopt the minutes of the Finance Committee meeting held on October 16th, 2023. I'll poll each member for their vote. Dr. Pagan?
Yes.
Dr. Katz?
Yes.
Ms. Hernandez-Pinheiro?
Yes.
And I vote yes as well, so the motion is adopted. So I move to enter into an executive session to discuss confidential and privileged matters that may be related to threatened and potential litigation. Do I have a second?
Second.
Jose?
Yes.
Dr. Katz?
Yep.
And Sally?
Yes.
Okay, so we'll go into,
Are we twisting rooms?
yeah.
Okay.
Okay. questions.
Okay, so executive session is adjourned. We're back in public, open session. We have a couple of items for consideration today related to the Hertz, and I think, Sonia, are you gonna?
Ted's gonna kick us
Ted,
off.
okay. Ted, if you could kick us off on a discussion that I think relates to all the resolutions we're gonna be talking about today.
Yeah, sounds great. So if we want to go to our first slide here, what I wanted to do is just give a quick lay of the land about where things are right now at this stage of the crisis, or rather the stage of asylum seekers still coming to New York City every day for help, and just to give a sense of what's changed, and then we're going to go into some of the details and some proposals for today too. So, thinking back to October 22nd or October of 2022, this is where there was EEO, Emergency Executive Order 224, signed. It was October 7th of 2022. And that was really declaring that we were seeing such a high number of asylum seekers coming into New York City each day that something had changed from the current state before that. Fast forwarding to today, we've now across New York City helped more than 150,000 asylum seekers, and those are the people that have come into our city system and received shelter. But among them, more than 75,000, or well over half of them, with our help, with our city's help, have been able to complete their journeys and exit our city system. One of the very important ways that that's been done is through things like figuring out what people's barriers are and helping them to surmount their barriers. And we're going to be talking more about that as case management. We're going to be talking more about that shortly with the resolution. Our role in this as health and hospitals is really threefold. Number one is we've helped to open humanitarian centers. There are currently 16 H&H humanitarian centers. We are serving more than 23,000 people each day now. That started with, I remember our first humanitarian center was the Row Hotel back in October of 2022. So we've grown a lot since then. Our second role is that we continue to operate the city's arrival center. The arrival center has now helped more than 80,000 asylum seekers, being the front door that everybody comes through. And just to draw a distinction against other places like Texas, here in New York City, we have a very regimented approach offering healthcare as a human right from the moment you come into our site. You're screened for communicable diseases, active tuberculosis, chickenpox, varicella, and COVID. We then check in with you to see if you have any urgent medical needs. We've had children that need to be immediately restarted on anti-epileptic medications. We have had women that have delivered babies the same day upon arrival, or received their first prenatal visit at 9 months pregnant. And then we screen everybody for depression. People have been through a very traumatic journey to get here. We use the same depression scale and process, including escalation if you are severely depressed, that Mitch and I use in our primary care practices at health and hospitals. We then offer to vaccinate you and your children. We've predominantly vaccinated children. We've done more than 50,000 vaccines to date. So that's what we do at the Arrival Center and our humanitarian centers. We also, H&H, provide basic necessities that go beyond just medical care. That includes food, clothing, as we've talked about, shelter, and helping with resettlements. And that's the third role that we have now, is we're helping the city to implement a full case management program so that we can, whether you're a family at a DHS sanctuary hotel or a family at the Row Hotel that we operate, we want to give you the same opportunity to engage with the case manager, see what your barriers are, and do everything in our power, literally move heaven and earth to get you what you want, to help you to exit our system, to celebrate your birthday this year in your new apartment. In terms of in the New York City November plan, we received the following for HERCs. For fiscal year 24, 2.17 billion. Fiscal year 25, 2.82 billion. We've incurred 429.3 million of HERC expenses in Q1 of FY24, and OMB has provided H&H with revenue through the HERC MOU that we have with the mayor's office to cover committed expenses to date. With that overview, I will turn it back to Sonia. I think
we'll.
Okay. Turn to Chris.
Again, a list of the centers and what the occupancy is, because you've got like tens of thousands in one place. What do you have, 100 in another? I mean, how big is the range?
Yeah, well, so our largest site is the Row Hotel. And at the Row Hotel, we have close to or up to 4,000 people staying there each day, and that's all families with children. We then have some smaller sites, such as the Wingate, which has, Chris can correct me, 170 something rooms, something like that. So a much smaller number of people there each day. So there is a variety there, but the Row Hotel, it is incredible to think that there's 4,000 people that we're helping there each day, and then all their kids go to school each morning.
Can I ask two questions before
Yeah.
Chris? Well, actually, Jose, do you have any? Any questions, other questions? Would you say occupancy is pretty much 100% all the time? Yeah, okay, that's what
Pretty much.
that's what I think you mentioned on the case management, and maybe, Chris, you will get into this, but you said we're helping city with all of them. So the case management services we're gonna be doing is not just for our 16 sites?
Correct.
It's for, right,
And actually, just to say another word about it, case management is basically the process of identifying barriers and helping people to overcome their barriers. Mitch and I, in some ways, are case managers in medical care. I think an important point is that we uniquely in New York City, to power up this effort, which we're about to tell you about how we want to implement, we have to know something about you. Well, what are your barriers? Can we at least get started with understanding if you submitted certain forms for asylum seeking status, for work authorization? Do you have a brother in Chicago? Have you thought about being reticketed somewhere? Do you have a job lined up? We've done a survey where we've had over 90% of everybody in every part of our city system, not just our 16 sites, but the city system, has completed that survey, so that we can know things like, the percent of people that have completed this form or that form, but much more importantly, we know you as an individual, where you are in the process, what you've told us your barriers are, and that when we start this with the resolution here, it's to bring on help so that we can offer you targeted help to help you to overcome the specific barriers, because everybody has a different situation. So we're sort of, I say all of that to make the point that in New York City, we have the data that I don't think anybody else has to really jumpstart the process and really hit the ground running.
and two quick things. So when you speak of HERC, that refers to the 16 centers. Those are the 16 centers. But when we talk about things like the HERC expenses and how much we have gotten in the financial plan, that also includes the arrival center
Correct.
too, right?
Correct.
And yes, it's just everything we're doing related to the, okay.
Yes.
So, sorry, with no further ado, go ahead, Chris. Thank you, Ted.
Yeah.
Yeah.
On to the next agenda item? Okay. I just framed up a good bit of what we're looking to talk about here. That is with the case management, right? How do we help people overcome those barriers? So this is an RFP to bring in some national experts to help us move through that work. So for committee consideration, this is authorizing New York City Health and Hospitals Corporation to execute contracts with Cherokee Nation Management and Consulting, LLC, International Rescue Committee Incorporated, Horn LLP, Rapid Reliable Testing, NY LLC, DBA.go Inc., and MedRight LLC, DBA MedRight Urgent Care, for HERC case management services at a not-to-exceed amount of $176.8 million, for a contract term of 1 year and 2 6-month renewal options, exercisable at the discretion of the system. So Ted just touched on this a bit, so I'll try to move through the background a little bit quickly here. But we're currently providing general casework services. This can be things with helping families or individuals with their court dates, childcare plans, work authorization, resource navigation. It's a wide range of things. Discharge planning, if somebody's coming out of the hospital, we want to make sure that they're getting back into one of our sites safely. If somebody is pregnant, we want to make sure that there's the right type of coordination so that they get benefits they're eligible for after that baby's delivered. We want to make sure that they can get home safely from the hospital with that newborn, all those types of things. What we're looking to do is strengthen and expand casework services specifically for exit planning. Not just helping with those other services I just mentioned, but really be thinking about how do we help people who are currently in our care at these sites move on to their next chapter. And so we're looking to bring in some of those national experts to help sort of supercharge that work. As Ted just described, we're helping to lead that effort citywide. We're currently using existing contracts with DocGo and MedRight. DocGo, we have committed $2.1 million through November and paid out $0. This is work that began with them relatively recently. MedRight has committed, we've committed $596,000 through November and paid out $0. As you said, this RFP sought to expand the casework capacity and services scope and bring in some of that national expertise. We're completing reference checks for the 3 new vendors, and the other 2 are the incumbents that are mentioned there, DocGo and MedRight. As with the other ones we'll talk about today and all other HERC contracts that we brought to the board, all expenses here will be covered by the HERC MOU with the mayor's office. The RFP criteria, we were looking for 3 years in business performing services at a similar scale, MWBE status plan or waiver request, and $3 million in annual revenue for each of the last 3 years. We expect that this is going to be some pretty sizable work. We wanted to make sure that these entities had some element to sort of carry their payroll, especially during the ramp-up time, because this is a staff-intensive body of work. Substantive criteria, 30% for relevant experience, 25 each for readiness to deploy and cost, and 10% each for capacity for national resettlement services and that MWBE. Capacity for national resettlement services was an important one here. We wanted to think about if there's a national entity that we could partner with here that had a network of folks all across the country that they could help some of our guests get connected with. If they had partners, you know, maybe it's Catholic Charities in Chicago or in Los Angeles, if they had those networks and they're talking with one of our guests and that guest might be interested to go to that other part of the country, that our partner might be able to help leverage their own existing resources to get that person to that new space successfully. Because it's important not just to have folks exit, but to be able to have them exit successfully. So when they get to where they're going, they can stay there, that they're actually on their feet, and it's not that 2 weeks later they're on the street in Chicago or Los Angeles, or that they're coming back to New York. If they want to be in Chicago, we want to make sure that that's a successful transition. Our evaluation committee here, we've got ambulatory care operations, HERC finance, reconnection/case management director on the HERC side, behavioral health, as well as the assistant director on population health. For procurement, we went to the CRC in late September. Through October, we posted on the city record and sent to 13 vendors and then held the conference, pre-proposal conference, where 61 vendors attended. Ultimately, 13 proposals were received, and in mid-October, the committee met, and the top 5 scorers are the ones that we're seeking to move forward with.
Yes. What would the average revenue be for the ones that were selected?
That's a good question. I don't know that answer offhand, but can follow up. I expect it's well north of $3 million a year.
It sounds like you're also considering a multi-level kind of work where you would hook up some individuals and families with other families that might be here already. Is that what I'm hearing?
I think we're going to try,
Like to move them from one state to the other?
I think that if there's opportunities in that example, right, the Chicago example, now whether that's going to be 1% of families or 30% of families, we don't know. But we want to make sure that if we've got partners that can bring those pathways and bring those avenues, bring those connections, that we can leverage those. And I think with the vendors that we're seeking to move forward with, there's at least 2 or 3 that can bring some of those resources to bear, so we can try to leverage that.
Is there anything else that you would like to see before they get moving on to the next stage? Because we wouldn't want them to fail in the transition.
The families and the individuals. Yeah. I think that's, and I'm sure Dr. Long may have things to add here, but I think a lot of what we're hoping here, or expecting here, is with these national experts that we're bringing in, they're going to help us be able to think through what are those sort of prerequisites, what are those requirements that we're going to work with those families before we make that connection to Chicago, to make sure that they can do it successfully. We're going to be relying on their expertise.
Thank you. Thank you.
Next up, I think, was the vendor performance for the incumbents with rapid reliable testing. DocGo, you see satisfactory there. On the next slide with MedRight, the same is the case. For our 3 new entities, there were the 2 incumbents, but just a brief word here on the 3 new entities that we're seeking to move forward with. Cherokee Nation Management and Consulting, they're a federally licensed minority business enterprise. They've completed over 115 emergency preparedness and response projects, very much sort of in the sweet spot of what we're looking for this body of work. The approach to their case management very much aligns with our red, green, yellow, our red, yellow, green stratification, which we haven't discussed, but that's in effect a shorthand for what types of barriers are the families facing. Green means they're ready to move relatively quickly. Yellow, slightly higher barriers. Red, they've got some real challenges that they're going to face before they might be able to move out of city-supported housing. So the Cherokee Nation Management approach very much aligns with that sort of stratification and thinking about the different interventions needed for those different situations. They've active recruitment pipelines across a variety of specialties. This is really important. They're going to be able to bring in different types of case managers maybe for those reds versus yellows versus greens. They might be able to bring in people with different types of experience for single adults versus families. They can bring in some of that specialty recruitment, which is really important here. For the International Rescue Committee, they're a nonprofit industry leader. This is a household name in many circumstances. They're going to be able to help partner with us in terms of thinking through overall strategy. They provided asylum seeker casework and reception services to over 100,000 asylum seekers across the country. Very, very experienced in this space. And they work with clients who come from over 170 countries. They're really helping us to think through some novel models on how to really help individuals resettle. So we're excited about a possible partnership here with them as well. For the third vendor on the next slide, that's the new one we're seeking to move forward with, is Horn LLP. They've worked with state and federal entities to provide national resettlement services to over 85,000 asylum seekers. Again, very, very relevant experience for what we're looking to do. They've been working on work authorization, temporary protected status. They also have pretty extensive experience in New York City and New York State, which is really helpful. They sort of understand how the city works, and so that's a nice advantage with this entity. As with I think all of the contracts that we've brought to the board in this HERC space, work will be assigned based on operational need. There's no guaranteed minimum for any of these entities, right? There's no certainty that we would be assigning them any minimum amount of work. So it depends on what our need is, what their capacity is, and what the sort of financial benefits are to us going with one vendor versus another to meet that operational need. And this, like other HERC contracts, the work can be sunset quickly and the contract can also be terminated. There's no requirement that we continue working with them for the duration of the contract. If our involvement in this space were to sunset the day after we execute the contract, that's fine, we could walk away. Vendor diversity, the vendor diversity team set a goal of 35%. You see one marked as 0, International Rescue Committee, they're a nonprofit, but each of the others met that 35% standard.
And Chris, although it doesn't go for our statistics, in a sense, the Cherokee Nation is a minority-owned business, but I assume they just haven't registered with the city?
Correct,
Is
they're
that-
federally registered as of now, but they've already said to us they intend to apply, if they haven't already, for the city or state
Okay,
certification.
we should encourage that and keep them at it because, right, otherwise it's not clear, what a major commitment you've made to minority vendors because it just you're doing it, but it doesn't show.
Then next here, so we're seeking approval to enter into the contract with Cherokee Nation Management, International Rescue Committee, Horn, DocGo, and MedRight for HERC case management services with a not to exceed of $176.8 million. This NTE is based on assumption that caseworkers will be available 16 hours a day and doing at least 3 sessions per month with each of the households or individuals, families, however that breaks down, but with each of the households across our system. For each of the HERC households using sort of what our historic population rates would look like, along with a little bit of buffer just because if there could be a little growth, we want to be sure. Contract start date, January 1st, with a term of 1 year and 2 6-month optional renewals, exercisable at our discretion. And these expenses, as I said at the beginning, would be covered under the HERC MOU with the mayor's office. Thank you.
Questions?
Very quick question. Will you be kind of affirmatively setting up either seminars or some kind of session to help people understand what other states, cities are available to them, what's attractive about them that they could consider, or are you doing that one-on-one individually?
The primary method that we're assuming we're going into with right now is that would be part of those one-on-one discussions. But those are types of things that we've done in the past, and I wouldn't be surprised if we come back to them. There's been some programs within New York State where they've been able to offer resettlement upstate
Right.
with possible pathways to agricultural jobs, for example. And we were able to hold public information sessions and say, hey, if you're interested in this type of job and you've already applied for work authorization, or maybe you already have work authorization, here's how to get involved. So I wouldn't be surprised if we continue to try those kinds of pathways too.
What's the average size of the family?
3.
3
It's
now.
oftentimes 2 adults sorry?
I said 3 now.
Right.
So it's oftentimes 2 adults and 1 child, but there are oftentimes 1 adult, 2 children. We've got a wide mix. Intergenerational households as well, where we've got 3 generations traveling together. We've got a wide variety and mix of family types.
Yeah.
I would think mother and children and not the father sometimes.
It's a wide variety, and oftentimes grandmother or grandfather coming. We've seen, I imagine, every which combination you could think of.
Thank you.
Other questions? No. I just have one question. The services, I see how you are estimating the NTE, but how do they price their services? Is it like a daily rate or number of families
These-
helped, or?
These are primarily driven by straight staff rates. So it's sort of an hourly rate for this type of staff versus that type of staff. And then different vendors will have slightly different staffing models. So, they might have, I mentioned, I think it was for Cherokee Nation Management, they had that robust capability to do recruiting and onboarding of different types of caseworkers. Those different types of caseworkers, it's possible that they might have slightly different hourly rates. And if we need more of the intensive case management, that might be with the more highly skilled caseworkers, they would be at a higher rate. Whereas the lesser skilled caseworkers, it might be a lower rate. And then each of them might have different type of supervisory, ratios, 4-to-1, 6-to-1, 8-to-1, depending on the intensity of that work. And then the vendors are different even within that.
So it's pretty different each from one.
I think the standard thing would be it's a team structure with hourly rates for the staff, but then what those teams really look like varies.
Yeah, and how does what the RFP results yielded compare to what our contracts were prior to the RFP?
I think they're very comparable, right? Yeah, I think the current work that we're doing that was cited at the beginning there with the DocGo and MedRite rates, it's very comparable to where we were at now. We're bringing in these new national experts, so there's an element of sort of paying a premium for that expertise.
Right, it's different expertise.
But it is comparable in rates ultimately.
It's a kind of job that there's really no economy of scale, right? Because
fair to say.
it's a case manager
by
with a
case,
person, right? So you do 500, you do 1,000, you're gonna need twice as many hours to do, right? It's not like you're producing a product, right? Or so.
But we're bringing in different skill sets here, and it doesn't sound like the cost differential is that different. I mean, in terms of all.
I think that's right. I think that's right. And then one of the things ultimately that we'd want to be seeing in this space is this casework. We're hoping and expecting that what it's going to start to show is we're able to resettle those families, help them move out of city-supported housing. And so the more expertise we bring, the hope is that we can lower the overall census. We can lower the overall expense to the city. We don't need as many hotel rooms or other HERC resources. What we're looking to do is invest in helping folks get onto their 2 feet.
And we could probably spend an hour talking about this, but how do you allocate? Like, how are you going to they sound like very different types of organizations, the 5 vendors, and so how will you decide how to use them?
Yeah, we're working through that right now. Working with them operationally to understand sort of where their deepest strengths are within the expertise that they're bringing. I expect we're going to look at a couple of those national experts to first work with us on the greens and yellows. Work with those folks who are sort of closest to being able to move out, who have some of those lowest barriers, to help move them out first, to help get them resettled quickly. I think we'll probably wind up using one of the other vendors, or a combination maybe, on some of those sort of red families that have the higher barriers, that need more intensive case management. I think we'll probably wind up splitting it that way, but we've got a lot of conversations still to do with the partners.
And who's been doing that work that you've been talking about, the RGY?
So that's within with our teams. That's sort of some of that work that was mentioned there with DocGo and MedRite so far. But what we need to really do is scale up to sort of meet the needs of the full population across the city, to be able to move quickly and help get those greens and yellows sort of onto their feet outside the HERC system.
And one more just note about that is I've thought about it more from the point of view of effectiveness, but I think there's also an efficiency component you're pointing out here, Frida, which is when the first dollar is spent for one of these new organizations to come on, they're going to be speaking to somebody where on the computer screen they have where their barriers are listed, whether red, yellow, green, what some of their goals are to help them to complete their journeys. So it's going to be like, again, like a supercharged effort. It's not like they're going to have to spend, weeks or months
Starting
just
from
figuring,
the
starting from scratch. They're going to be able to build on a very, very strong base that I don't think any other city has.
Great, great.
And
What will our evaluation look like, not just now, but over a period of time?
Yeah, I think a key component of our evaluation is what Chris said, which is how successful are we in helping you to complete your journey, meaning you've left our city system and you've either resettled somewhere else, found friends or family in New York City, been reticketed to your brother in Chicago, found that job you wanted because we coordinated OSHA training for you. I think that ultimately, I think a big important metric of success for us is going to be how many asylum seekers in our system with our help have been able to leave our system and complete their journeys and celebrate their birthdays in their new apartment.
Keep our system successful.
what
Celebrate their
happens, building on what Barbara just said, what happened to all those people that aged out? They did their 60 days and they moved out. Have they cycled back in, or, do you know?
They may need
So no families with children have reached 60 days yet in terms of the notices that have been given. So this will be an important piece of helping families with children be successful in taking their next step forward in particular. Among adults, we've initially we had 60-day notices and now 30-day notices. And adults, when they hit that time period, are leaving the sites where they're currently at. And we've had an effort on our end to help them doing a similar type of case management to help to identify what their barriers are and help them to be able to successfully leave. And that's why the majority of adults, the vast majority, that have received a notice have not come back into the city system. I believe the statistic is around, I think it's over 3/4 of adults that have received a notice are not in our system today. Well, let me double check and get you the exact statistic on that. I think it's 23%, but I'll have to double check.
Great. Well, why don't we take this for a vote? All those in favor?
Aye.
Aye. Opposed? Okay, the resolution is passed. Resolution number 2, Chris? Thank you.
2 of 3. So this for committee consideration, authorizing New York City Health and Hospitals to execute contracts with Rethink Food, LIC Com, LLC, DBA Commissary, Bridging Cultures Group, and RC Stillwell, LLC, DBA Riviera Caterers for HERC catering services at a not to exceed amount of $355 million for a contract term of 1 year and 2 6-month renewal options, exercisable at the discretion of the system. So what we're looking to do here is to be able to provide 3 meals a day. This is just for our 16 HERCs, right, and the arrival center. 3 meals a day for each of the folks within the care at the health and hospital HERC locations. We're seeking vendors to provide this nutritious and culturally competent food. We've been doing it for a year now and continue to sort of refine and improve the operation, which we're happy to speak to in a couple minutes when we get there. We're currently using 2 existing contracts with Rethink Food and LIC Com. Our historic spend there with LIC, we've committed $52.6 million through October and paid out $42.5 million. And with Rethink, we've committed $31 million and paid out $18.3 million through October. These contracts are priced on meals per person per day. So it is a flat rate for the day for that person. There's no ancillary costs. RFP done here, we're looking to competitively bid to identify additional vendors that could be well suited to meet our operational and financial needs here. We are completing multiple reference checks for Bridging Cultures Group and Riviera Caterers. As I said with the case management, all expenses here will be covered by the HERC MOU with the mayor's office. So I'd be happy to speak to this one, but I know Dr. Long enjoys speaking to the successes of our food program, so I'll turn it to him for a moment.
Well, again, it's another zero cost thing that we did. So initially, when we started to open our humanitarian centers, we pretty much exclusively had asylum seekers from South America, predominantly Venezuela. So we were trying to think about the menu that might be food that they would want to, nutritious food that they would want to eat. But then I remember there was a day where it was at Randall's Islands, and we received something on the order of 70 or 80 men from Africa, so not from Venezuela, completely different palates, different dietary requests, things like that. And also, they all wanted to, they were Muslims, they wanted their food to be halal. So we quickly ran into this issue of we needed to figure out how we could have all food be, first off, something that people even could eat, so halal versus not, and then something that people would want to eat. So how do we figure out what somebody from Venezuela and somebody from Senegal would both want to eat? And there's no other better way, and this is this is a very effective zero cost thing that we did. We just did a survey where people rated every meal, and it turns out that there were some very common themes. So there are certain meals that nobody liked. For example, roast beef, nobody in the world likes, which is not surprising because I don't like it either.
Me neither.
And it turns out there's also some meals that everybody likes. This is New York City, so of course we're proud to say the meal in the world that everybody likes is Italian food. So we took away things on the menu, added things in greater frequency based on what people literally voted on. And then for the issue of people wanting to be comfortable that food was halal, so they wouldn't have to worry about whether one dish was not. At our sites, 100% of the food is and has been halal. So not only you don't have to worry about whether food is halal or not, but the meal in front of you is something that you probably voted on.
And so we've had, for the RFP criteria, we were looking at 3 years in business performing food services at a similar scale, MWBE status, plan, or waiver, and $1 million in annual revenue. We wanted to keep this a bit lower, $3 million on the last one. This one we were interested to see if there was additional vendors that might be able to be eligible by keeping that dollar threshold low. Substantive criteria, we were looking at 30% relevant experience, 25% each for readiness to deploy and cost, and 10% each for cultural competency and MWBE. On our evaluation committee, you see operations on ambulatory care, hospitality and logistics staff from the HERC side, the folks who are really running that program day to day on our end, grants director, and then central health and hospital staff that are involved in the food program across health and hospitals health system, management services, and Bellevue's plant-based lifestyle medicine program. Overview of procurement. In July, we went to the CRC. In September, it was posted on the city record and sent directly to 11 vendors. At our pre-proposal conference, 50 vendors attended. Ultimately, 23 proposals were received in late October. In November, the evaluation committee met and sought to move forward with the 4 top scoring vendors, which are the 4 that you see there. Vendor performance, we're looking to move forward with the 2 incumbents included, both of which we think here and LIC Commissary on the next have both been satisfactory in performance. We've been very happy with each of them. For the new vendors coming to the fore, we're looking at Bridging Cultures Group. This is an Arab American woman-owned MWBE vendor capable of providing full services within 10 days of contracting. Their menu blueprint, we asked each of the vendors to provide sort of a sample menu of what it would look like. Their menu blueprint meets cultural competency goals. We wanted to make sure that they could have sort of a responsive to the different flavor palettes of the guests coming in from around the world, and we saw that they could do that. And they also comply, as everyone needed to, with the New York City food standards. And they've done longstanding community work throughout the city. Riviera Caterers is an MWBE vendor experienced in providing meal services to asylum seekers. They've worked with some of our other city agency partners. Their sample menu also was reflective of our needs, what we were looking for there, and meet the food standards. And they also can rapidly deploy following contracting. As with the other contracts we brought, work here will be assigned based on operational need, vendor capacity, and financial competitiveness, which is to say nobody's guaranteed any work. They need to be financially competitive with the others that we've signed with, and they need to be operationally responsive and effective, or we just move the work away or never assign it in the first place. As with the other contracts, this contract can be sunset at any time on relatively short notice, and certainly we can also just move the work away with even less notice. There's no commitment beyond 30 days for really being able to, once we assign them work, we can scale it down relatively quickly. Vendor diversity, we've got three at 100% here, the 3 awardees that are MWBE. LIC Com is an incumbent. Bridging Cultures Group is an Arab American female-owned entity, as I described. They're also partnering with Jabber Dorado Enterprises as one of their subs. and Riviera Caterers is an NYC certified women-owned WBE. Rethink, like IRC in the previous one, is a nonprofit. So they're not eligible for MWBE status, but they source their meals and services from partners that are oftentimes, including several Black-owned businesses that have pending application for MWBE status with the city or state. They partner with other registered 501c3 organizations or work with Arab American male-owned businesses that are ineligible for MWBE status.
Sort of similar as with the other question, if they, assuming you give them work and, which I understand isn't promised, and they work with other minority businesses, do those show as part of the spend or not?
Their subs would absolutely show as part of the spend. I'm looking
And
at procurement just to make sure I'm not overstating.
For the nonprofits.
that's what I'm asking.
Oh, for the nonprofit.
Should be a line for that.
Keith, just say it again next to the mic.
If the vendors are not registered as diverse vendors with the city or the state, they would not show in
Sure.
our standard report.
But would they show if the prime is a nonprofit vendor?
No.
A nonprofit vendor uses a minority business to provide, and the minority business gets some of the money. The dollars show or the dollars don't show?
Typically don't show. We have 2 large contracts with nonprofits where we track them, but we haven't historically tracked those nonprofits doing business with certified diverse vendors.
I don't know that there's any rule that says
Can't.
you can't or shouldn't. I mean, it's in the, I mean, it's the very thing we're supposed to be doing.
Happy to discuss it further. I think our policy right now has it that we don't have MWBE's goal setting on nonprofits.
Correct.
Right.
But I 100% agree with that because we all own nonprofits. That's how nonprofit law works, right? All New Yorkers have a piece of every nonprofit that New York State approves as a nonprofit. But because we show our data based on spend, it seems to me that if a nonprofit is spending the money through a city or state entity, that should show on our stats.
We could apply it for, like, really just right now, we have 2 nonprofits, I think, that have goals where, you know, we negotiated with them, said, I know you're nonprofit, totally exempt, and asked them to have goals nevertheless, and we do track those. But it is not our standard practice to do.
Okay. Could you look into whether it could be our standard practice?
Absolutely.
And related to that, I'm sorry, there was some other part of that you were reminding me of. Oh, in the case of an application, we would certainly wish them to do the city, even though as a matter of inclusiveness, we include the state.
Correct.
Is that part of our standard, please do the city?
Correct.
Okay.
Right. I think the case that mentioned the state here had some certifications pending was just a coincidence. These vendors were already in the process before they came to our attention.
So we're seeking approval to enter into a contract with Rethink, LIC Com, Bridging Cultures, and Riviera Caterers for recruitment services with a not to exceed of $355 million. This NTE is based on maximum occupancy at HERC sites for guests 3 meals a day utilizing historic rates. The contract start date would be January 1st with a term of 1 year and 2 6-month renewal options exercisable at our discretion. And these expenses, as said, would be covered under the HERC MOU with the mayor's office. Thank you.
Great. Questions? No. Can I, sorry?
I just said impressive under my breath.
Is the cap the same for all the,
On the RFP, we set a cap of saying everyone needed to come in at or below $14.40 per person
Per
per
day.
day. and they all did. Otherwise, they wouldn't have been eligible for review. And then some of them that we're moving forward with, there's certain scenarios where they've gone even further and said we can come in under $14.
Wow.
If there's certain scale that's met, right? If you do more than 5,000 or 20,000 or however many meals during a certain day, they get that economy of scale and they can lower their prices. We've been working since the beginning of the HERC program to bring down the catering prices considerably. And we're looking forward to bringing it from that $14.40 even further down in the months ahead as we continue to work through the logistics, think through how to move this more efficiently while still
While still
maintaining
take-
our strong food standards and
Yes.
having good quality.
What is our current average rate?
$14.40,
That's what we're paying now.
correct.
I see. So the RFP did not substantially lower the costs, but
We
That's
capped it
right.
at that level.
We capped it at that, and they were coming in under it. It may have been, I would need to go check the timing. We were not too far before we published the RFP, we were actually paying a rate slightly above that. So it's possible when we published the RFP, we actually were pulling it down, and our incumbents came down in line with where the RFP was published. I don't remember the exact timing, though.
But it's come down from what we had been playing. The one question though, the 60.8 million that's been spent, is that a year's worth of spending or
I believe so, right?
Since we launched, so since October, when we were utilizing whichever vendor when Rethink came on, but LICCom is who we began with in October 2022.
right? So, but we're now expecting quite a large increase. That's due to population increase because obviously our rates are better.
Right.
And the uncertainty of the future, just making sure that we have enough buffer if the city needs H&H to respond and support any other sites moving forward.
Okay. Thank you. Okay, well, I will, if no other questions, take this one for a vote. All those in favor, please say yes.
Yes.
Any opposed? Great. So that one is approved to move forward to the board, and we have one more?
One more.
Yes.
Okay, so this one is for laundry services. This, for committee consideration, is authorizing NYC Health and Hospitals to execute contracts with Happy Nest, Inc., Sodexo, Inc., Sun International Trading, LLC, and Burn Blue 2081 Flatbush Avenue, LLC DBA Blue Laundry Services for HERC Laundry Services with a not-to-exceed of $33.8 million for a contract term of 1 year and 2 6-month renewal, options exercisable at the discretion of the system. This RFP, these contracts, what we're looking to be able to do is provide routine laundry services for the guests. Many of the folks that are coming to us, especially the most recent arrivals, they're coming with a single bag. They're coming with the clothes that they've been traveling with for some number of weeks or months, and being able to show them the respect of helping them with their laundry here when they first get settled is one of those really powerful sort of welcoming elements. And so we're looking to be able to continue moving forward with that. Providing these effective laundering services at significant scale, right? For a program that has 23,000 guests, we want to be able to go to scale and provide these services. We're currently using Sodexo and Happy Nest. With Sodexo, we've committed $6.1 million through October and paid out $3.7 million. With Happy Nest, we've committed $0.65 million through October and paid out $0.52. Sodexo and Happy Nest have slightly different operating models. Sodexo operates on a per pound basis, how many pounds of clothes, whereas Happy Nest does a flat rate per bag. And so there's different sites where that can be more or less effective using one model versus the other. There's no ancillary costs here. As with the others that we've talked about today, the RFP was done to competitively bid to find new vendors to compete and sort of go through the competitive bidding process here. We're continuing to complete multiple reference checks for Sun International Trading and Blue Laundry Services. And the expenses here will be covered under the HERC MOU with the Mayor's Office. Minimum criteria here, 3 years in business, performing laundry services at a similar scale, MWBE status, utilization plan, or waiver. And again, $1 million here. We wanted to be able to see if there were smaller entities that we might be able to get into the mix. Substantive criteria, 30% relevant experience, 25% each for readiness and cost, and 10% each for cultural competency and MWB. Evaluation committee, this is ambulatory care operations, The HERC Hospitality and Logistics, those are the folks that run the day-to-day operations for this body of work. HERC CFO, the Director of Management Services from Health and Hospitals, the actual health system side of the house, and then our laundry lead on the HERC, who's really managing the vendors on an hour-to-hour basis. Overview of procurement. In August, we went to the CRC. In October, it was posted to the SETI record and sent to 10 vendors. Soon thereafter, the conference was held, pre-proposal conference was held, 8 vendors attended, and ultimately 10 proposals were received in November. Soon thereafter, we met, the evaluation committee met, and seeking to move forward with the top 4 scorers, who you see listed here. For our 2 incumbents that we're looking to move forward with, we've been, we rate them as satisfactory for both Happy Nest here and Sodexo. They've been effective in this space with us. For the new vendors, Sun International and Burn Blue. Sun International is an Asian woman-owned MWBE with 10 years of city contract experience, who says they can scale rapidly. Their facilities are located throughout the city, which offers sort of logistical convenience, where if we've got HERCs throughout the city, the trucking, the logistics aren't as complex if they've got multiple sites around the city. For Burn Blue, they're applying for MWBE status directly in addition to already submitting a plan that would adequately meet their MWBE standards, and they have capacity to deploy immediately. As with the other contracts, no minimum requirement for work to be assigned. It depends on operational need, vendor capacity, and financial competitiveness. And as with the other contracts, they can be sunset at any time with less than 90 days notice, and work can be reassigned on very short notice. The vendor diversity team here set a goal of 30% on this solicitation. You see 2 of them met that 30%, Happy Nest and Blue Laundry Services. Sun International themselves is MWBE. Sodexo, though, is at 16% on this slide. We've been working with them aggressively over the last week. I expect by the time we'd come back to the board, that number will significantly increase. We've gotten a new plan from them in recent days that move that 16% considerably up. Now, whether it gets to the 30% or not, I can't say with confidence yet, but I can say it's going to get us considerably closer, and we're going to push until they get there. We've made it very clear that this is exceptionally important from us operationally and exceptionally important to the leadership of the organization at the board of directors, and they've committed to us that they're going to find a way to get to the 30%. They made it this far on the scoring because even not hitting that 30%, their scoring was strong enough on the other criteria that they were still able to make it into the top 4, but they understand this is really important to us, and they've committed that they'll be able to get to 30%. So we're seeking approval to enter into this contract with Happy Nest, Sodexo, Sun International Trading, and Blue Laundry Services for HERC Laundry Services at a not-to-exceed amount of $33.8 million. This NTE is based on maximum occupancy at HERC sites and guests receiving laundering on a weekly basis utilizing historical rates. That's actually more robust than we currently have, so there's a little bit of buffer in here in terms of the weekly basis. It's less frequent than that. Contract start date is January 1st, 2024, with a term of 1 year and 2 6-month renewal options. And as noted, all expenses under this would be covered by the HERC MOU with the mayor's office.
Questions?
Does this cover bedding as well?
I'm sorry?
Does it cover bedding?
There is some budgeting that's in there that includes bedding. There's very few sites where we actually need to do that, right? You think about the hotels where we might house people, that's included as sort of the nightly room rate at a hotel,
Right.
but there are certain sites where we want to have that flexibility. So we have tapped into those linen services with Happy Nest and Sodexo.
Roosevelt isn't run as a hotel. We're using it.
Roosevelt, they provide the laundering
They do?
services, right?
Oh,
They provide the laundering services, they provide the housekeeping services, just like they would if it were sort of a hotel open to the public.
It was important to the unions to be able to be sure their employees wouldn't all be on the street.
Oh,
Right.
okay.
So if we did those jobs ourselves, then there'd be all these people unemployed
Right.
from those hotels.
Sodexo, we've had a long history with them, haven't we?
And so important here is this would be a separate contract for these HERC services, separate and apart from the system-wide Sodexo contract.
I think actually a really important point that it's a good example of we've had a long history with them on the hospital side. As we were building these sites, we operate them like we'd operate a hospital. We broke down each service, including laundry. We had the opportunity to build off of our relationship and experience with Sodexo to move at the pace we needed to move at. And now we're going through the RFP process to make sure that we have the most competitive bids.
On that, can you comment on sort of, you talked about the pricing model for Sodexo and Happy Nest. Are the other vendors kind of similar model, different models, and how did the RFP process help, you know, get us more, obviously got us more vendors, but in terms of the pricing results?
Yeah, so the pricing results, the new vendors also are coming in more akin to the Sodexo model, more on a per pound basis. Happy Nest seems to be a bit of the outlier as far as we can tell in terms of that per bag scenario. But again, that works well for us at certain locations. That Happy Nest per bag scenario in small to medium sized sites, we've seen that there's actually more efficiency towards doing a per bag rate. It's less staff intensive. We find other efficiencies in the system of doing it that way. But we are seeing the new vendors coming in at a per pound rate. Those new vendors coming in, it's tough to compete with somebody as big as Sodexo, right? They are a large, I'm not sure if they're multinational, but they're certainly a national corporation here. And so it's going to be tough for one of these local laundromats, in effect, however big they are, to compete with something as large as Sodexo. So we see them on a per pound, but it is more than Sodexo on a per pound basis.
Okay. So one question, as you were talking about the evaluation committee and people, we have Senior Director Herc Hospitality and Logistics, Chief Finance Officer Herc, Laundry Lead Herc. Are these new individuals that we hired for Herc? Are these people that moonlight like?
So it's a mix. I'm not sure if you would consider Dr. Long and I sort of moonlighting, or if we'd be.
I consider you moonlighting.
Okay, so
Thank you.
Your CEO considers you moonlighting.
so then there'd be a few on this list that are moonlighting, and then one or two that are new hires.
I see. Okay, thank you. Any other questions? All right, so we'll take this one for a vote. All those in favor?
Aye.
Aye.
Any opposed? Okay, thank you.
Thank you very much.
Thank you very much. Thanks for the briefing.
Of course.
Doing a lot. Okay. John.
Hello, how are you? I just want to point out, it's an observation, I don't think Chris used to speak that fast.
Ted is rubbing off.
But I'll try my best to keep pace, and I know we're running short on time. First I'd like to say, I think through the first quarter, the system's performing very stable, performing actually pretty well through the first 3 months. Our cash in September was $962 million. I think today it's about $600 million. So this is a high point in the year for us, but we still feel pretty good about our days cash on hand. Again, through September, the net budget variance would beat the budget by 1% or $49 million. Continuing to see improvement in direct patient care receipts. It's up almost $134 million compared to the same period last year. So that's not against the budget, that's like actual to actual performance. Some of that is money that we earned last year that rolled in, but we would have counted it in the previous year. I think really supporting that is the fact that our volumes are back for certain. Compared to pre-COVID, inpatient volumes up by 1%, and really remarkably, outpatients up by 9%. And I think you can't say that throughout the entire city. I think we're excelling in this area of bringing back volume.
Great.
We raised the bar again on our strategic financial initiatives to over $1 billion, and through the first quarter, we've accounted for about $217 million. We usually start a little bit slower and catch up towards the end, but I think against all the different domains that we list here, and we do meet, once a month, and the sponsors that are assigned to each of the initiatives, reports out, and I think we're doing fairly well for there. Cash in November is estimated to close at $650 million. As I said today, we're at $600 December. We're forecasting to be at $500 million when we close the month. Managing risks, a little bit different format. We'll keep track of this as we, go through the year and add to those.
It's like the red, green, yellow.
Yeah, red, green, yellow. I think, yeah.
We have red, orange, yellow.
Yeah, we have orange, yellow. But I think maybe the last time we met, one of these was maybe at a higher alert status. But again, we'll keep our eye on these items plus, any other headwinds that we encounter. But staff recruitment, retention, temp services, and sessional, we've been, spoken about that before, trying to shed our dependence on, contract staff overall, particularly nursing, where during the peak of COVID, we actually 20% of our nursing staff were temps. And we've started a system-wide, effort, to, reduce our dependence on temps, particularly nursing. We referred to it as the all hands on deck, which is really having folks within central office working with, the facilities. We check in once a month, our group, the finance team, pairing up with Natalia and the nursing team, as well as Yvette and HR. And we have meetings with our counterparts, out in the facilities. And the theme around all hands on deck is, recruit, which we're finding success in recruitment. Now that we have the NISNA contract, we're doing pretty well in terms of hiring new nurses, and excited about that. Retention, we want to keep the nurses that we have. We do have, a turnover rate that we'd like to bring down. And then the last is convert, right? We would like to invite those nurses that have been with us on a contractual basis to take on a permanent job, with us at Health and Hospitals. We welcome that. Some of them have been here for 18 months to 2 years. So that's the kind of the strategy there. And we have what we call the glide path, which is really a finance model to keep track of how we're forecasting new hires and then the release of temps. We call that the glide path. I think we have a slide in the back that shows that. We'll keep showing that to you. I think we're doing pretty well, right? As I said, new recruiting is up. We're also, working on releasing those, temp nurses as we see, appropriate. I think what does a little bit has this concern is down on the last bullet is sessional spend, which is really better referred to as like overtime spending for our providers. And we are seeing an uptick in spending. We saw it last year. I think we talked a little bit about it. We're forecasted, I think we're 22 million over, and we're forecasting that to continue. So it's an effort that we're working on with, the facilities and our affiliate partners, and perhaps we can come back and talk at our next meeting in February about the steps we're taking to try to, better allocate, sessional spending time. We have a strategy there that we're employing. Supply chain inflation, like we know inflation has really been, hurting the economy a little bit, but, getting a little bit better and more under control. I think healthcare as a sector got really hit disproportionately. We were the same. For example, I think pharmacy spending year to year was up $70 million, and we're looking at explaining to ourselves why that is. Is it price? Is it utilization? This again might be an area where we come back and talk about our strategies around pharmacy. And we may have mentioned at our last meeting, we did implement a $90 million facility savings gap closing plan. And I'm happy to report that when we meet with the facilities every month, we track this, particular items. They all came up with their own plans. They all met the $90 million, target, and they appear to be, for the most part, that's, it's challenging for them, but for the most part seem to be on track there. The city-state budget challenges, obviously we have to, keep our eye on our city and state, partners. A large portion of our revenue comes from the city and the state and the federal government. The state budget director came out with a letter actually recognizing that their financial situation had improved at the mid-year point. I think they reduced the value of their deficit down to $5 billion. It grows a little bit in the out year, but I would say on a $230 billion budget, that's manageable. But the budget director did also indicate and gave direction, to the state agencies to keep their budgets flat. So I think they're still, trying to prepare, and mostly I think preparing themselves for some greater out-year challenges. But we'll continue to work with the state, follow the budget as it develops. The city, on the other hand, is, reporting growing gaps, largely, I think, because of the influx of asylum seeker spending. I think their gap's around $7 billion. We will, in the next slide, James will go through what they call the PEG, program to eliminate the gap. We're on our third PEG, and we'll go through, how we met that target of 25 to 28 million, and we just got direction on a fourth PEG that is due, I think, this coming Friday. So we keep trying to manage the PEGs as best we can. And again, we'll go through, our plan for, PEG number 3. Federal budget, the dish cuts were delayed with a continuing resolution through, January 19th. Obviously, we'll keep our eye on that one as Congress continues to grapple with their budget. And we did a pretty thorough review of the IPPS rule, and it does have an impact, but we think it's manageable. Medicaid research is yellow. Our target there was a 76% research rate, and I think we may have some information in here in the back, but we're coming in at 80% at this point in the year, and Health First and Metro Plus are one of the higher performing, plans in the state. So I think it's a good relationship we have going, with our partner health plans that I think is allowing us to, to beat the state on the research rate. There is headwinds there. We'll report back, but I think the next wave of populations coming up for research is going to be a little bit more challenging, but again, we're working through that with our health plan partners in the state.
Thank you.
Any
So-
questions there? Yeah. Yeah.
Particularly on this last item, are we hearing any potentials for retirees and any kind of movement in that area?
As it relates to the Medicaid research
Oh,
or the nurse staff recruiting.
both actually.
Yeah. I would say on the staff recruitment, and this, I appreciate that question, because I think we would like to, as I said, with its 3 prongs to how we're trying to address and stabilize nursing. And it's recruitment, we'll come back and provide numbers there. The retention and the number of nurses that are within the retirement range, right, is I think a good number for us to have a conversation with you about. I don't know it off the top of my head. The Medicaid research is just a process, because of the pandemic, the federal government and the state government worked together to put a hold or a delay on recertifying it. Every year you're supposed to recertify for Medicaid, and rightfully so. They decided, because obviously people needed health care services, let's delay or suspend the research. So that's in play now, and it's quite a cumbersome process. And what I mentioned about in January, I believe, there's a portion of the research process that takes place on paper. And that obviously is going to be cumbersome. And what's concerning is this isn't the SSI population, which tends to be the more disabled population. And it's that group that we cannot lose connection with. Many of them have pretty significant serious mental health problems. And one of the things I mentioned to Health First and to Metro Plus, and maybe we even have to go to the state and have a conversation about it, because that is the most vulnerable population. Mm-hmm. And for them to kind of navigate the research process is a challenge. So we're going to keep a close eye on that, and I hope I
would hope that the state would step in.
Yes, I think so. And again, they've been very good. I mean, they've been open to us. We've called them. They've been, they're interested. They want us to be successul. That is for certain. I don't know if we can say that for other states, because the research rate in other states really spans, quite a distance, right? Some are not even at 50% research. So. But we'll report back on both of those things. How are we doing on the nurse retention part, and then maybe we can go a little bit deeper on the research.
From the feds as well here with this?
Yeah, the feds, Yeah, on the research piece, yeah, the feds have given states some flexibility, right? When you go forward and ask them, right? Presumptive eligibility is a term that they use, and maybe again, I think it's we'll see how it goes with the SSI population, but presumptive eligibility means given you have a history with this patient and you know their condition, it's very likely, right, that they would recertify as being eligible for Medicaid. So they use this term presumptive, right? And then you go back and check. And if you find out that they weren't eligible and you were actually securing, federal reimbursement via the Medicaid program, there's a process you pay back the feds. So it's finding that balance of, you could be wrong, but it's going to be a small percentage versus the risk of losing the connection of the person and losing their insurance coverage. And for us, we just can't let that connection happen, that break in our, clinical relationships happen because they've lost their insurance. And I mentioned it's very, obviously it's important to us because it's a large portion of the population we serve.
Do we see a lot of that work being done by our centers?
Yeah, our centers.
QHCs?
Yep, yeah, they, and again, the report that we get from Health First and Metro Plus, kind of ranks the hospital systems and how they're doing, versus the benchmark, right, of 75%. And we all, for the most part, most health systems in the city are doing pretty good job, right, on the research.
Okay.
So it's good. And again, I think it's nice having good partners with your health plans, especially on complicated, important issues like Medicaid research. So I'd say we feel pretty good about that.
Thank you, Barbara.
Yeah.
So we are very woefully behind time,
Okay.
so
All right.
can we?
Should
That's
we
okay.
go in 1.5x TED Talk, or should we?
Maybe just hit the highlights here
Yeah.
because there's.
I think the PEG is worth certainly talking about the third bullet, James, if you want to go through that.
Sure, I think just as John noted, there was a PEG of 5% for us and other city agencies in the November plan, which was released in mid-November. And in order to meet this PEG, H&H, we did a few different administrative actions, including in-housing consultant work, doing some internally driven programmatic modifications, billing improvements, and some central office contract and administrative expense reductions. All of these did not have impacts on patient services, but were able to allow us to meet the target that's in that table at the bottom of 25 to 28 million per year.
Okay, thank you. And there's another exercise ongoing.
It's ongoing. Yeah. It's due Friday. It's underway. We'll report back on that
Okay.
in February when we meet. Yep. So maybe we could just do slides 8 and 9, and if it's okay with the group, maybe we could come back in February and talk about the other slides.
Apologize, everybody being here for all
No,
this
it's okay.
time.
We appreciate all
Yeah,
of this.
thank
But is that okay? Micheline, do you want to do 8 and 9?
Yeah, so just real quick, maybe even starting from the bottom to the top of the revenue side, John had mentioned our improvement, doing better than budget on the revenue side for 140 million. We're starting to see the benefit definitely of the increased volume and better performance on the inpatient and outpatient, which we're expecting to see more. There's definitely more opportunity as the actual receipts come through the door. Risk pool is another big one, which we're well ahead of budget there, both almost kind of a split between our improvement on the PMPM side and also some reconciliations from prior year hitting this year. On the other end, on the expense side, the next slide, we see that we are spending over budget by about 98 million. None of these categories will surprise you again, like our temps. I would say the good news is as we are pushing a lot on the recruitment and the retention side, we're going, in the process of training our nurses, and they're going through orientation now, which we're definitely not increasing or seeing the increases in the temp side of the world on the dollars that we have seen before, and those will level, we're starting to level off and will be going down for the second half of the year as our nurses are trained and complete orientation. affiliation John mentioned earlier on the sessional side, and overtime, we're expecting that also to start coming down a little bit as we hire more and as post-collective bargaining, we see better recruitment titles across the board. Next slide is just actuals to actuals, just focused on the revenue. Different view again on against the budget for the first bullet. Year over year, we are definitely seeing the increases in the actuals, 134 million on the pure patient revenue, and then we have more on the risk side. In addition to the other, components and pools, again, the volume is up, well ahead of last year, particularly on the inpatient side, and we expect to see more of that materializing. And so our opportunity in the budget itself is even more, right, than the improvement that we're seeing year to year. So we're hoping to meet that budget.
Micheline, what is HCW bonus?
Oh, so this is the healthcare worker bonus that comes from the state. Yeah.
Right.
So
Got it.
it has like an expense and revenue component. We pay it and get reimbursed.
Yeah, I'll just mention, I think the risk pools have been great for us. We perform, and maybe we can talk about that when we get together next time, because Megan has done a tremendous amount of work there.
Yeah.
But I don't think we're gonna get the same level of performance next year, right? And I think we're gonna have to prepare for that. The state is starting to reduce the growth rate in premiums, Medicaid premiums. They're starting, to signal that they are seeing, very good performance, across the state. So I think there'll be a tightening next year on the risk pools, and we'll just have to prepare for that.
Is that on your orange and yellow?
We're gonna put that up, and it'll go on our orange and yellow,
Dashboard.
yeah, for next year. But I think we're starting to hear more about it, and it does make sense. So we'll try to
Yeah.
factor that in.
I hope that page doesn't go to 2 pages.
No, we've had that same conversation, right? We'll put only the very most important.
But yes, I recognize there's a lot that you're balancing and juggling here. And I, again, apologize that we can't get to all the materials, because there's a lot of good work being done behind the scenes to keep this going. I mean, our performance, all things considered, is still doing quite well. So.
Yes.
And I know that's a lot of the work that we were going to talk about today that is supporting that, along with everything else you guys are doing. So any other questions or comments? Well, thank you very much. If there's no, I guess I have to do this formally. Is there any old business? Any new business? There being no further discussion, meeting adjourned. Thank you, everyone.
Happy holidays.
Happy holidays,
Meeting
yes.
is no longer being recorded.
Yeah.